Sugar is part of every kid's life. After all, isn't candy one of the things children crave, clamor for, and look forward to as a treat? But there is a growing epidemic in this country that extends to our children. That epidemic is obesity. And with obesity on the rise, so is a disease of the system that regulates the sugar in the body, diabetes. Diabetes is a disease that keeps the body from making or properly using a natural hormone, insulin, to regulate the sugar level in the blood. There are two types of diabetes that are most prevalent in children. Type 1 diabetes is typically an insulin-dependent form of diabetes. Type 2 diabetes, the type of which we've seen the greatest increase in children over recent years, may include insulin treatment, but is often controllable through diet and exercise. Obesity has been linked with a number of illnesses, and research has shown that 85% of children with type 2 diabetes are obese. Type 2 diabetes has risen along with obesity due to inactivity sparked by screen time, supersized meals, and family genetics. While obesity is a major red flag, what other signs might allow you to tell if your child could be suffering from diabetes? Symptoms often include increased thirst, increased urination, including bedwetting, weight loss, often with an increase of food intake, dehydration, persistent vomiting accompanied by weakness or drowsiness, blurred vision, and in infants, a severe diaper rash that doesn't respond to treatment. You may also find that your child experiences frequent infections or that they have cuts and sores that are slow to heal. If your child has any of these symptoms, your pediatrician will be able to do some simple tests to determine if they may have diabetes. If you discover that your child has type 1 or type 2 diabetes, what can you expect? First, understand that neither you nor your child is facing this alone. Over 13,000 children are diagnosed with type 1 diabetes each year. You will find yourself supported by an entire healthcare team that will evaluate the best course of treatment and changes in lifestyle for your child. This healthcare team will include your pediatrician, a dietitian, and your pharmacist. Together, the healthcare team will work with you and your child to teach you more about the disease and the care that will be required. You will be given careful instructions on monitoring blood glucose levels to maintain your child's health. Diet and exercise will be an important part of the regimen. Physical activity of 60 minutes a day can help to lower your child's blood glucose or sugar and control their obesity. A dietitian or nutritionist will help you determine the best food intake to control your child's sugar levels. Between meal snacks such as fresh or dried fruit, cheese or peanut butter crackers, yogurt, trail mix, or vanilla wafers can serve to boost low blood sugar levels. Your pediatrician or diabetes specialist can offer directions on the latest glucose monitoring instruments and other diabetes devices. Remember at all times that your child and you are the team leaders. Carefully following the plan constructed by your healthcare team will be what stands between your child's health and the devastating effects that diabetes can have. Diabetes is a systemic disease, meaning that it wreaks havoc on every part of the body if it goes unchecked. Kidney failure, nerve damage, and loss of eyesight are among the toll diabetes can take if the illness is left untreated. Talk to your pediatrician today if you suspect your child may be suffering from diabetes.